2 years ago, a 66-year-old man named Thomas sat in my office for a routine checkup. He felt perfectly fine. No chest pain, no shortness of breath, no dizziness. His weight was healthy. He walked 3 miles every morning. He hadn't missed a checkup in over a decade. On paper, Thomas was the picture of cardiovascular health. But I noticed something during our conversation that changed everything. Something no test had caught. Something no previous doctor had flagged. His hands. While he was talking, I looked at his fingertips. The color was subtly wrong. His nails had a specific shape change that most people would never notice. And when I pressed on one nail bed and released, the blood took too long to return. I ordered a full cardiac workup that same day. Within 48 hours, we discovered Thomas had significant blockages in two major coronary arteries. He was walking around with a heart attack waiting to happen, and the only visible warning was sitting at the ends of his arms the entire time. Thomas looked at me and said, "Doctor, I've been staring at my hands my entire life. How did I miss this?" The answer is simple. Nobody taught him what to look for. I'm Dr. Arav Menon, and this is MediGentle. I've spent over 25 years in cardiovascular medicine, and today I'm going to show you 5 signs hidden in your hands that could reveal heart disease long before the typical symptoms ever appear. No equipment needed, no blood test, just your own 2 hands, and the knowledge most doctors never have time to explain during a 15-minute appointment. These 5 signs are used by cardiologists worldwide as early clinical indicators. Some of them are taught in medical school. Some are picked up only through decades of clinical experience. All of them are things you can check yourself, at home, starting tonight. Before we begin, quick question. Look at your hands right now. Really look at them. When was the last time you examined them closely? Drop your answer in the comments. You might be surprised how many people say never. Let's start with sign number 5, the one hiding in your nail beds. Before I walk you through the 5 signs, I need you to understand something that will change how you look at your hands for the rest of your life. Your hands are the farthest point from your heart that still receives a rich blood supply. They sit at the very end of your circulatory pipeline. And because they're so far from the pump, they are the first place where reduced blood flow, oxygen deprivation, and vascular damage become visible. Think of it this way. If there's a water pressure problem in your house, the last faucet at the end of the longest pipe shows the problem first. Your hands are that last faucet. Every finger contains tiny capillaries, the smallest blood vessels in your body. These capillaries are so narrow that red blood cells have to squeeze through them one at a time. When your heart isn't pumping efficiently, or when your arteries are partially blocked, or when your blood oxygen level drops even slightly, those capillaries are the first to be affected. The skin on your hands is also relatively thin compared to other parts of your body. Changes in blood flow, oxygen saturation, and vascular function show through more easily here than almost anywhere else. Cardiologists have known this for decades. During physical examinations, experienced doctors routinely examine the hands before they even reach for a stethoscope. The hands tell a story. They reveal what's happening deep inside the cardiovascular system without a single invasive test. The problem is that most people have no idea what to look for. They see a color change and assume it's the cold weather. They notice a nail change and think it's a fungal infection. They feel tingling and blame it on sleeping in the wrong position. Sometimes those explanations are correct, but sometimes those small changes are your body's earliest and most visible warning that your heart needs attention. The 5 signs I'm about to share will teach you the difference. Let's begin with number 5. Sign number 5, slow capillary refill. This is one of the simplest cardiovascular tests in all of medicine. Paramedics use it. Emergency room doctors use it. Cardiologists use it. And you can do it right now sitting wherever you are. Here's how. Hold one hand in front of you at heart level. With the opposite hand, press firmly on one fingernail for 5 seconds. You'll see the nail bed turn white as blood is pushed out. Now release. Watch how quickly the pink color returns. In a healthy cardiovascular system, the color should return in less than 2 seconds. The blood rushes back in because your heart is pumping efficiently and your capillaries are responsive. If it takes longer than 2 seconds, that's called delayed capillary refill, and it can indicate several cardiovascular concerns. Reduced cardiac output, meaning your heart isn't pumping with sufficient force. Peripheral artery disease, meaning the blood vessels in your extremities are narrowing. Dehydration severe enough to affect blood volume. Or systemic conditions affecting circulation. A study published in the journal Critical Care Medicine confirmed that capillary refill time is a reliable bedside indicator of peripheral perfusion and can signal cardiovascular compromise before other symptoms become apparent. Now here's what most people get wrong about this test. Temperature matters enormously. If your hands are cold, capillary refill will naturally be slower because cold causes blood vessels to constrict. This doesn't necessarily mean heart disease. It means the test conditions weren't right. Here's the gentle way to do it properly. Warm your hands first. Rub them together for 30 seconds or hold them under warm water. Make sure you're in a comfortable room temperature environment. Then perform the test on at least 3 different fingers and note the average response time. If your capillary refill is consistently over 3 seconds across multiple fingers in warm conditions, that warrants a conversation with your doctor. It doesn't mean you have heart disease. It means your circulation is giving you a signal worth investigating. Try it right now. Both hands. 3 fingers each. What did you see? Tell me in the comments whether your color returned fast or slow. Sign number 4 is one that develops so gradually most people never notice it changing. But when you know what it means, you can never unsee it. Sign number 4, nail clubbing. This is the sign I found in Thomas, the patient I told you about at the beginning of this video. And it's one of the oldest known physical indicators of heart and lung disease in the history of medicine. Hippocrates, the father of medicine, described it over 2,400 years ago. It's still called Hippocratic fingers in some medical textbooks. Here's what nail clubbing looks like. In a normal finger, there's a natural angle between the base of your nail and the skin just above your knuckle. If you hold your finger sideways and look at it in profile, you'll see a slight dip where the nail meets the cuticle. This angle is usually around 160 degrees. In clubbing, that angle disappears. The base of a nail becomes puffy and swollen. The nail curves downward more than normal, wrapping around the fingertip. The fingertip itself appears wider and rounder, almost bulbous. Here's a simple test you can do right now. It's called the Shamroth window test. Place both index fingernails back to back, touching them together like a mirror image. Look at the small diamond-shaped gap that forms between the nail beds where they meet. In healthy fingers, you'll see a clear tiny window, a small diamond of light between the nails. If that window is gone, if your nail beds press flat against each other with no gap, that's a positive Shamroth sign. And that's a clinical indicator of clubbing. Now here's what makes this sign so important for heart disease specifically. Clubbing develops because of chronic low oxygen levels in your blood. When your heart isn't delivering enough oxygenated blood to your extremities, the tissue at your fingertips responds by growing differently. The nail bed becomes spongier. The connective tissue thickens. The shape changes gradually over months and years. Conditions strongly associated with nail clubbing include congenital heart disease, endocarditis, which is an infection of the heart valves, and various conditions that affect oxygen exchange in the lungs, which then impact the heart. A review published in the journal Heart found that digital clubbing remains one of the most underrecognized but clinically significant physical signs in cardiovascular assessment. Critical gentle note. Clubbing doesn't appear overnight. It develops slowly over months. Many people have a mild natural curve to their nails that is completely normal. What you're looking for is a change from what your nails used to look like. If your fingertips are noticeably rounder or puffier than they were a few years ago, and the diamond window test shows no gap, schedule an appointment with your doctor and specifically mention clubbing. That single word will prompt them to investigate further. Number three is something you feel rather than see, and it's often dismissed as nothing when it could be everything. Sign number three: persistent tingling or numbness in the fingers. Let me tell you about another patient. A 71-year-old woman named Patricia came to me not for her heart, but because she was dropping things. Her coffee cup, her phone, her keys. Her grip strength seemed fine. Her neurological exam was normal. But she described a constant tingling sensation in her fingertips that had been gradually worsening for over a year. Her previous doctor told her it was carpal tunnel syndrome, but the pattern didn't fit. Carpal tunnel typically affects the thumb, index, and middle fingers on one hand. Patricia's tingling was in all fingers on both hands. Symmetrical, persistent, worse at night. That pattern pointed somewhere else entirely. Her heart. When your heart doesn't pump blood efficiently enough to reach your extremities, or when your arteries are narrowing due to atherosclerosis, the tiny nerves in your fingertips are among the first to suffer. Nerves are extraordinarily sensitive to oxygen deprivation. Even a small reduction in blood flow can cause tingling, numbness, or a pins and needles sensation. This is called peripheral neuropathy when it's nerve-related. But the underlying cause can be cardiovascular. Reduced cardiac output, peripheral artery disease, or chronic inflammation in blood vessel walls can all restrict blood flow to the nerves in your hands. There is also a direct connection between persistent finger tingling and microvascular disease, a condition where the smallest blood vessels in your body narrow and restrict flow. Microvascular disease is a significant risk factor for heart attack, particularly in women over 60, where it's frequently missed because standard cardiac tests focus on large arteries. Research published in the journal Circulation found that microvascular dysfunction is present in a significant proportion of patients with cardiac symptoms, but normal coronary angiograms, meaning the big arteries look clear, but the tiny vessels are compromised. Here's how to evaluate your tingling using the Mediginal method. Ask yourself 4 questions. Is the tingling in both hands? Is it present in most or all fingers? Has it been gradually worsening over weeks or months? Is it worse at night or when you're resting? If you answered yes to 3 or more of those questions, this deserves a cardiac evaluation, not just a neurological one. Tell your doctor specifically that you want your cardiovascular health assessed in relation to the tingling. That specificity matters because it directs the investigation toward the right tests. Patricia's cardiac workup revealed early-stage microvascular disease. Caught early, treatable, manageable, because she listened to what her hands were trying to tell her. Number 2 involves a color change that appears so subtly most people blame it on something else entirely. Sign number 2: unexplained color changes in your fingers or palms. This sign has multiple variations, and each one tells a slightly different story about your cardiovascular system. Let me walk you through the 3 most important ones. Variation 1: persistent bluish or purplish tint in your fingertips. This is called peripheral cyanosis. It occurs when the blood reaching your fingertips contains less oxygen than it should. Healthy fingers are pink because oxygenated blood is red. When oxygen levels drop, blood becomes darker, and the skin takes on a blue or purple hue. If your fingertips frequently look bluish, especially when you're not cold, this can indicate heart failure, valve disorders, or conditions affecting oxygen exchange. It means your heart may not be moving enough oxygenated blood to your extremities. Variation 2: pale or white fingertips. Consistently pale fingertips can indicate poor arterial blood flow. If the arteries supplying your hands are narrowing due to atherosclerosis, less blood reaches your fingers. The skin loses its healthy pink color and looks washed out, waxy, or unusually pale compared to the rest of your hand. A study in the European Heart Journal found that peripheral pallor in the extremities, when not explained by cold exposure or Raynaud's phenomenon, can be an early marker of systemic atherosclerotic disease affecting multiple vascular territories, including the coronary arteries. Variation 3. Red or unusually flushed palms. This one surprises most people. Persistent redness across both palms, called palmar erythema, can be associated with several conditions including liver dysfunction and hormonal changes. But it can also indicate a hyperdynamic circulation state where the heart is pumping harder than normal to compensate for a problem elsewhere in the system. In some cases, palmar erythema appears alongside early congestive heart failure, where the heart is struggling to maintain adequate circulation and overcompensates in certain vascular beds. Here's the MediGentle self-check. Stand in natural light near a window. Hold both hands out, palms up. Compare the color of your fingertips to the color of your inner wrists. Your fingertips should be a similar healthy pink. If your fingertips are noticeably bluer, paler, or more flushed than your wrist skin, that's a discrepancy worth noting. Now flip your hands over. Look at your nail beds. Press on one nail and watch the color return. Is the returning color pink and healthy, or does it look pale, bluish, or dusky? Check both hands. Compare left to right. Differences between the two hands can be especially significant because they may indicate a blockage affecting blood flow to one side more than the other. Important MediGentle note. Color changes can have many causes. Cold environments, Raynaud's disease, anemia, and even certain medications can affect hand color. A single observation does not mean heart disease. What matters is a persistent pattern. If you notice consistent color changes across multiple days in warm conditions, document it. Take photos in natural light. Show your doctor. That documentation is more useful than trying to describe it verbally. And now number 1, the sign that most people dismiss as a normal part of aging. It's not, and missing it can cost you years. Sign number 1, persistent swelling in your hands and fingers. This is the sign I see missed most often, because almost everyone over 60 experiences some swelling in their hands at some point, and almost everyone assumes it's arthritis, water retention, or just a normal part of getting older. Sometimes it is, but sometimes it's your heart sending you a distress signal that nobody is reading. Let me explain the cardiovascular mechanism behind hand swelling. When your heart begins to weaken, even slightly, it becomes less efficient at pumping blood forward through your circulatory system. Blood starts to back up. Pressure builds in your veins, and fluid begins leaking out of your blood vessels into the surrounding tissues. This is called edema. Most doctors associate edema with swollen ankles and feet, and rightfully so. Those are the most common locations because gravity pulls fluid downward. But edema can also appear in the hands, especially in the morning. If you wake up with fingers so swollen you can't remove your rings, and this happens repeatedly, your heart may be struggling more than you realize. A study published in the Journal of the American College of Cardiology found that peripheral edema, including upper extremity edema, is present in a significant percentage of patients with early-stage heart failure, often appearing months before the classic symptoms of breathlessness and fatigue become noticeable. Here's what makes hand swelling particularly valuable as an early warning. Ankle swelling can be caused by prolonged sitting, standing, heat, medication side effects, and dozens of non-cardiac causes. Hand swelling in the morning, before you've been upright long enough for gravity to play a role, is a more specific indicator that fluid retention may be related to cardiac function. Let me share one more patient story. A 68-year-old woman named Catherine came to see me because her wedding ring no longer fit. She'd worn it for 42 years. Suddenly, over a period of about 3 months, her fingers had gradually swollen to the point where the ring was cutting into her skin. She assumed it was arthritis. But arthritis swelling is typically located at the joints. Catherine's swelling was throughout the entire finger, uniformly. Her knuckles weren't red or inflamed. Her fingers were simply thicker everywhere. I ran cardiac tests. Catherine had early stage diastolic heart failure. Her heart was stiffening and not filling properly between beats. Fluid was backing up throughout her system. The first visible sign happened to appear in her hands. We caught it early. Treatment began immediately. Catherine responded well, and the swelling gradually resolved over several weeks. Here's the MediGentle self-check. Every morning this week, before you get out of bed, look at your hands. Make a fist. Do your fingers feel tight, stiff, or swollen? Try to slide your rings on and off. Is there more resistance than usual? Check again in the evening. If the swelling is present in the morning but reduces during the day, that pattern is more concerning for cardiac causes than swelling that appears only at the end of the day. If you notice persistent morning hand swelling on 3 or more days in a week, schedule a cardiac evaluation. Specifically ask your doctor about an echocardiogram to assess heart function. That one test can reveal what your hands have been trying to tell you. Now I want to step back and connect all 5 signs together. Your hands are not just hands. After 60, they become a daily cardiovascular monitoring system that you carry with you everywhere. No batteries, no appointments, no cost. Slow capillary refill tells you about your circulation efficiency. Nail clubbing tells you about your blood oxygen levels. Tingling and numbness tell you about your microvascular health. Color changes tell you about your oxygen delivery and vascular tone. Swelling tells you about your heart's pumping capacity. Each sign addresses a different aspect of cardiovascular function. Together, they create a picture that is remarkably informative. I'm not suggesting you diagnose yourself. That's never the purpose of MediGentle. What I am suggesting is that you become an informed observer of your own body, that you notice changes, that you take those observations to your doctor with specific language and specific questions. The patients I worry about most are not the ones who come to me with concerns. They're the ones who noticed something months ago, dismissed it, and waited until the problem became impossible to ignore. Thomas noticed his nails changing shape for over a year before I caught it. Patricia felt tingling for 14 months before someone connected it to her heart. Catherine's ring stopped fitting 3 months before she mentioned it to anyone. Your hands were telling them the truth the entire time. The only thing missing was the knowledge to understand what they were saying. Now you have that knowledge. Here's your MediGentle weekly hand check routine. 5 checks. 2 minutes. Once a week. Check 1. Capillary refill test. Warm your hands first. Press 3 different nails for 5 seconds each. Time the color return. Under 2 seconds is normal. Check 2. Shamroth window test. Press both index fingernails back to back. Look for the diamond-shaped gap. Present is normal. Absent needs investigation. Check 3. Sensation check. Close your eyes. Run each fingertip lightly across a textured surface. Can you feel clearly and equally in all 10 fingers? Note any tingling, numbness, or difference between hands. Check 4. Color comparison. In natural light, compare fingertip color to inner wrist skin. Both should be a similar healthy pink. Note any blue, purple, pale, or unusually red tones. Check 5. Morning swelling assessment. Before getting out of bed, make a fist. Try your rings. Note any tightness, puffiness, or resistance that wasn't present before. If any check shows a persistent change across 2 or more weeks, bring it to your doctor. Write down exactly what you noticed, when it started, and how often it occurs. That information is incredibly valuable. I want to end with something I believe deeply. Your body is constantly communicating with you. Every change, every signal, every subtle shift is a conversation your body is trying to have. The problem has never been that the signs weren't there. The problem is that nobody taught us how to listen. Your hands have been talking to you your entire life. Now you understand 5 words in their language. That's enough to potentially catch something early that could save your life or the life of someone you love. Look at your hands right now. Really look. What do you see that you never noticed before? Tell me in the comments. I read every single response, and I'll do my best to answer your questions. If someone you care about is over 60, share this video with them. Send it to your parents, your partner, your friends, not to scare them, to give them what you now have. Knowledge. Hit subscribe and turn on notifications so you never miss a gentle conversation. Take care of your heart. Take care of your hands. Take care of yourselves. Your body is talking. Now you know how to listen. I'll see you in the next one.